Hi, this is Irving Steele, your host of Local Issues, and today we're honored to have a special guest on the show. He's a veteran who served in the Navy, and we were just honoring our veterans and families of veterans over this last long weekend with Memorial Day weekend. And so we're very grateful for him and all his work that he does throughout the entire state of Connecticut for veterans and their families. So welcome, Paul, to the show. How are you?
I'm doing well, Irving. Thank you. Thank you for having me today.
Of course, and I know we've been in touch for a little while now, and I'm sure with your new role with the Connecticut Department of Veterans Affairs, you have a lot on your plate, a lot of things going on. You want to share a little bit more about your new role as the Veteran Services Supervisor throughout the state of Connecticut?
Well, certainly. I was recently hired as the Veteran Services Supervisor back in the end of February. It was a promotion from a Veteran Service Officer in the Norwich City Hall. That's where I was located.
Congratulations.
Thank you very much. And now my job is to oversee the 5 district offices that we have throughout the state, and our service officers. And there's 2 in each office, district office, and the districts are based upon each congressional district.
So that's why we have 5 throughout the state of Connecticut for the 5 congressional districts.
That is correct. And it's an important role because what I'm working on is getting education and training for our VSOs. Everybody has some sort of degree of education, but there was never nothing direct. It was on-the-job training, or what you came with beforehand. I originally started as the Assistant Service Officer with the American Legion in 2018. So that's where my accreditation came from.
Also out of Norwich?
No, that was out of the Newington office.
Okay.
Just so that you know, statewide, you have the American Legion, the VFW, and the DAV, and the Connecticut Department of Veterans Affairs. We're veteran service organizations that have veteran service officers that help veterans and their dependents file claims with the VA.
Okay. Yeah, maybe it'd be interesting to take a step back and, like you're starting to do there, dive a little bit deeper into a veteran service officer. Kind of, what does this role entail? What's the current status of them throughout Connecticut? Maybe you want to share some more details on the veteran service officers.
Okay. Right now there's 12 VSOs. We'll call it VSOs, Veteran Service Officers. 2 in each office except for Norwich. Norwich has 3. Our role is to, when a veteran has questions, they want to file a claim, a benefit claim for maybe an injury in service. Our job is to take them from the step 1 all the way through the claims process.
Kind of a helping hand along the way.
Correct. Because if you call the VA's 1-800 number, they will send you forms. And the variety of forms can be for any type of situation. So if you're not familiar, which you're not, you're going to be like, what's all this? Filling out the form. That's what we're there to help the veteran or the surviving spouse with claims. If you went to submit a claim, the veteran can submit a claim by themselves, okay, for benefits. Or they should go through a veteran service officer, an accredited service officer, and there's no charge, never a charge to a veteran or the surviving spouse to file a claim on behalf of themselves or the veteran. And we take POA, or power of attorney. The power of attorney that the veteran gives to the VSO is for them to have access to their files in the VA on the benefit side. The VA is split in 3 different categories. You have VA health care, you have VA veterans benefits, and then you have cemetery. You see how it all rolls together. The health care doesn't talk to benefits, and benefits doesn't talk to health care. You could be a veteran that's enrolled in VA health care, you can be being seen by the VA for whatever, as long as you meet the criteria.
Mm-hmm.
And some veterans don't know, especially the older ones, to file a disability claim.
Mm-hmm.
People getting out of the service today, they go to TAP class. They're educated on how to apply, where to go.
Yeah, and for our viewers who don't know, can you explain TAP, what that stands for?
That's Transition Assistance Program.
Exactly.
At the military installations.
Mm-hmm. So helping people through the transition of military life more back to civilian life.
Correct, and what's available to you.
Mm-hmm.
What you get out of it is what you listen, when you go to the class or whatever is given. I think it was like mandated in the late 90s.
It's a mandatory thing for all veterans coming back.
Anybody getting out to go through the TAP class, so you can know what benefits are for you. Here, you have service members getting out at the subbase or at the Coast Guard
Mm-hmm.
station. Those members can file a benefits delivery on discharge claim. You can do that within 180 to 90 days of discharge.
Mm-hmm.
And then when you get discharged, your benefits begin.
Mm-hmm.
That's where the education in those TAP classes, because you have a lot of those getting out are very well educated.
Mm-hmm.
And they know what to do, they know where to go. There's 2 VA representatives at the subbase that they can start those claims with. Mm-hmm. They don't necessarily have to come to one of our service offices to do those type of claims, because those people at the base, the 2 VA reps are there specifically to do that type of claim of benefits delivered on discharge.
Mm-hmm.
And most of our role is when you have the veterans that got out between Korea, Vietnam, in the 80s. I got a lot of people that served in the 80s that are now coming forward to file claims. But when you got out in the 80s, you just got out. Same thing with the other
TAP didn't exist back then.
Exactly, and it was all hearsay.
Mm-hmm.
The benefits you have as a military member, getting a free driver's license while you are on active duty, the only way you knew that you had that is if you ran into somebody from Connecticut, which is available, or a free car for taxes and stuff like that.
So a lot of it was just information all over the place, not one single repository for all the different benefits and services that might be provided to veterans.
Correct. No, there's a wide variety. We have a pamphlet at our office that has all the benefits for Connecticut veterans.
A pamphlet.
Free college, free college tuition, the property tax exemption.
And that's new, right? The property tax exemption?
No, that's old.
Okay.
Veterans that served in a wartime service are given a veterans exemption off of the assessed value of their property.
Okay.
If you have a service-connected disability rating, you get an additional veterans exemption.
Mm-hmm.
And when you're under 65, if you can go, it could be 10 to 90, but when you turn 65, you would get what the 100% rate would be for someone that was under. Now that there's a new law that was passed that veterans that are permanent in total, their dwelling or a car, if they don't have a dwelling, is exempt from taxation. And then the other 10 to 90% are prorated. They have a different amount for that. And that law was just signed last week by the governor, which is good because someone that's permanent total, you're a veteran, you're out there, you really can't work. It's just a little added, thank you for your service.
Yeah, and to your point, in regards of work and career, I'm really curious of how these different offices help for different specific benefits. What do you see as the most common service or benefit that veterans need to take advantage of or want to take advantage of?
A lot are looking for a little compensation.
Okay.
Tax-free money, which is understandable. if you had an injury in service,
Mm-hmm.
this has to be documented in your medical record, and you've been being seen for it over the years, for whatever it is, that's your medical nexus, you can file a claim for that. But if, say, you say, oh yeah, I hurt my back in the military, but you haven't been seen for your back, you'll be denied.
There's nothing they
because
can do.
it's 40 years since the veteran.
Mm-hmm.
But if you have a presumptive condition, as you know, of the PACT Act for the Gulf War veterans and for the Vietnam veterans, exposure to Agent Orange and exposure over in the burn pit area, you develop type 2 diabetes and you're a Vietnam boots on the ground veteran, and there's other areas, Laos and stuff like that. And you develop it today, you don't have to have a continuity of care.
Okay.
All you need to have is a current diagnosis, and you file the claim.
Mm-hmm.
And that's what we would help you gather what you need to gather, records, medical documentation, and stuff like that. And then the same thing on the veterans from the Iraq-Afghanistan wars. We've seen a lot of claims being adjudicated already. And it's all because of our Vietnam veterans that pushed, for Agent Orange back in the day, and they don't want the same thing to happen for their Gulf War veterans.
Mm-hmm. I understand. And even for that, let's say someone gets the benefits and is now on disability with them, that of course they want some kind of income or tax-free income, but if they receive these benefits, most of the time it's not enough for them to survive and have a life, is it? They need some kind of outside work or career. Can you share a little bit on that?
Veterans that have a disability rating doesn't necessarily mean that their disability keeps them from working.
Okay, so they can receive the disability payment and still have a job.
And still have a job, correct.
Okay.
There's certain, it's a different avenue, say if you have, and I'll just use a PTSD. If you have PTSD, but when you go to work, it keeps you from working because you're having trouble maintaining a job,
yeah.
and then that veteran may be able to apply for individual unemployability. And those are unique situations. Your doctor would tell you need a doctor's note saying or opinion that this service-connected disability keeps you from working. They just, it's not something that's handed out easily, but it's available. But when you're on individual unemployability, you can't have employment. You can make money up to the poverty threshold. I think it's like $14,000. Don't quote me on the amount, but you can have a job. You can still have a little job doing that. But when a veteran has a disability, they're getting a month. It's a tax-free per month. No 1099 at the end of the year. That's your money.
Direct deposit right into their account.
Right into your account. If the veteran is 30% or higher, then they can add their dependents, their spouse, their children that are, college age or less.
30% or more disabled.
And disabled, correct. 10, 20%ers, that's all you get. There's no adding a dependent to that. But the biggest thing is we have veterans that want to enroll in VA healthcare. So VA healthcare is means tested. If you make above the poverty threshold, I'll say poverty, we'll just say 40,000, married 40,000 a year or more. I mean, it changes every year. Then you're ineligible to enroll in VA healthcare because
Ineligible. Okay.
But the easiest way is to see if we can find a method of getting you a service-connected disability rating.
Okay.
And if you have a service-connected of 10 or higher, then you can enroll in VA healthcare, and it doesn't matter what your income is. Where you can get, and all you have to do, because I'm a Navy retiree, a lot of our retirees, I was under the same mindset. I didn't want VA healthcare or the VA to interfere with my TRICARE Prime. Well, I was disillusioned myself. You know, I went through the process, and it doesn't. VA healthcare is a standalone healthcare option for a veteran. It's only for the veteran, not for the family.
Mm-hmm. That's a big misconception, is that if you have the VA healthcare, that kind of interferes with the TRICARE Prime.
Yes, it's a misconception.
Okay.
A lot of people retire out of the military. We have a lot of them, you know, people from the 70s retired. I just had a few recently that they were happy with what they were getting, didn't really go back to think about the VA because they didn't think it was for them. And it's there for, you know, it's there for everybody if you can get into that. And it's not that hard to get into, but all you have to do is maintain. You have to go once a year for your annual physical. Okay. As long as the VA knows that you're being seen by your own primary care, you don't change your primary care doctor that you have. This is like, you can use it as, like, I'll say, supplemental. You get free eyeglasses. If you need hearing aids, you get free hearing aids. If you're taking prescription drugs, there's a copay. You know, the VA, if it's not service connect, if your drugs aren't because of your service-connected disability, you might have to pay a copay $7, $9, $12. Nothing too expensive. And a lot of veterans, they need that. You know, they're paying $300 a month for a prescription and find out they can only pay, you know, maybe $9. Everybody's different.
Yep.
You know, it's not. This isn't a quoting show. You said on my show, you know.
Of course,
like
every situation is unique and different, but
exactly.
You have the experience, knowledge, and ability to help many of these different veterans in their own specific situation.
Correct.
Which provides a lot of help and a lot of value to these veterans who are trying, my understanding, trying to kind of maneuver these large systems with many different constantly changing rules, right?
Correct. And they do change a lot, and that's what we're there for. You know, our offices are high call volume. You know, sometimes you may not get the call back the same day. It might be a week later because they're working on, you know, the next veteran in line, but they'll get to you. You know what I mean? And we generally don't get too much discouragement as long as they know that they're going to be, you know, they'll be heard, you know, unless they're terminally ill or something of that nature.
And most of the interaction, like you said, is through phone calls, or do you guys utilize email or mobile apps, anything like that?
We operate off of phone calls and in person. In
person too.
It's best to meet one-on-one with a veteran. The younger veterans, they get it. You know, when I say, can you, you know, I just need you to scan this document for me, and then you get a picture with a finger in. You know,
yeah.
They know how to, you know, email back and forth. When you have the older generations, and I think of my dad.
Yeah.
He doesn't have a laptop, and all I could see him was just like this dang thing, and you know, one of those. So I put my mindset there that there's other people out there like that. So we're here to, you know, help you, and in any way we can.
It's a great service to the veterans to have you and the 12 people throughout the state in this role. And it sounds like, as you guys have to constantly be up to date and know what the changes of the laws, both the state as well as the federal level, because so much is constantly changing. Meanwhile, you're having new veterans, like you said, coming back from the Middle East and other places who have maybe different issues or have different things that you can help them with.
Exactly, to guide them, you know, to best guide them into the right direction. And while we're on the air with that, with VA healthcare, a lot of people like, I need a ramp, I need a walker. Where do I get that? If you're enrolled in VA healthcare, all you have to do is talk to your primary care doctor. I need help at home. We get a lot of the, you know, veterans that are their 20s and 30s, and I'll tell them, you know, make sure you go to once a year to VA, you know, for your annual physical, because you're not going to be thinking about it now, but 40 years, 50 years from now, you might need a walker. You might need, you know, a ramp to get into your house. You might need a visiting nurse. And the VA can provide that for you. and at no cost.
Mm-hmm.
I've had a guy he went for his first VA healthcare appointment. He had one of those walkers with the tennis balls. He's like, Paul, my God, they took my walker and then threw it away and rolled in this red with brake handles. He goes, it's too fancy for me. But that makes you feel good because you did something to help somebody.
Mm-hmm. Definitely. And to your point exactly of doing something good to help other people, especially veterans, I'm sure many of our viewers are interested if you could share a little bit. A lot of people, of course, say, thank you for your service and appreciate veterans and are grateful for veterans to allow us to have the country that we have today. I'm curious if you could share a little bit more of what are some things if people are out in the community and they want to maybe become more involved with your office or support different veterans things. Do you have any advice or suggestions for people who want to help out with veterans?
Yes, if you want to advocate to help veterans, if you come across a veteran and you don't know, don't help them try to fill out forms with the VA. Just guide them to one of our offices, and we'll be glad to help them out. There's some advocates out there that go, they're doing okay, they think they're doing good, but they're doing more harm because they're telling the veteran what they might be entitled to. Nobody ever hears the word might, And then you got to talk them off the wall. Well, they said this, I should be getting, you may not qualify for something, And the best thing to do is if you we have like the municipal veterans reps, and each town should have one. We're in the state law that they should have one, where a veteran can go and someone in their town hall should be able to direct them. Send them to our office or, general questions. And there's a training that's taking place on Friday, June 14th at our campus in Rocky Hill. And they know about it already, the municipal vet reps.
Specific for the municipal veteran service officers.
Correct. No, municipal vet rep.
Vet rep, yeah.
Well, the only people that hold the title of service officers, you got to be accredited by the VA.
Yep.
There's only 20 in the whole state of Connecticut that can do claims, for free.
Understood. And your role obviously is very closely connected with our elected leaders, hence the 5 offices that you have throughout the state. And maybe you could share a little bit about, since you're here in the 2nd District with Congressman Courtney, how helpful is his office for veterans and veteran projects and services?
Very helpful. Manny Meneses, he's the veterans rep for Congressman Courtney's, and he's very well known. He helps.
Previous guest on our show here as well.
So you know him. He's very outgoing. Sometimes we'll get calls. Well, Manny's been mean to me, and we're like, well, you just don't like what you have to hear. That's the truth.
What's that expression? You can't handle the truth.
Right.
Yeah.
Exactly. And we do field calls because we'll have people that'll shop for VSOs.
Okay. Give them the best answer.
Right. You know that they're shopping. If you already have one, you just if you're with the DAV, you stay with the DAV. American Legion, and just so that there's 3 DAV VSOs. There's 3 American Legion, or 2 now, and then there's 2 at the VFW, and they're all on the 3rd floor at the VA in Newington. You could have a post-service officer. They can't help you with the claims. They can direct you, direct you to them offices. But those are the only ones in the state, unless there are accredited lawyers. But we don't want to go into that. Did I answer your question?
Yeah, definitely. That's really helpful. And we just have a couple minutes left here on the show. And one thing I feel for many people in the community and many of our viewers, the easiest way that they can kind of exercise their way of both being part of our democracy but also doing something to help veterans tangibly is helping to ensure we elect leaders and have leaders who truly provide tangible benefits and services to veterans. And so that being said, I'm just curious if you have any advice or suggestions to our viewers coming up. One of our previous guests was a veteran. He said, we can't have community without unity. kind of the importance of coming together as a community, Americans from different backgrounds, being together stronger as a country. Do you have any advice or thoughts to some of our viewers of maybe how to become involved in the community, or different leaders that they should or shouldn't support?
Well, the leaders, I can't comment on it because that's our democracy of whoever you want to support. However, veterans, all veterans, should be a member of either your American Legion or a VFW, first and foremost, or the DAV, because those organizations advocate in Washington for the rights that we have, the benefits that we have. Your VA healthcare wouldn't be possible if it wasn't for those veterans organizations pushing the PACT Act through Congress, because there's not very many veterans that are in the Senate or Congress. So if we don't have the voice of the veteran, the more it gets diminished. If we lose our voice, they're going to be like, well, we're not going to give you anything anymore.
Yeah.
So you need to be involved in that, in those organizations. There's plenty of coffee houses around, especially in our area. You have, what's the fella there? Philomena's, Mr. Buscato. You know, they have one down there. There's the one at Veterans Rally Point, the first and third Tuesday of the month.
Lots of coffee hours.
9 o'clock, they meet. They'll have a guest speaker, or it's a place for you just to mingle with your fellow veterans. And there's a lot of, and there's other ones around too. I don't know all of them, but Griswold, they have a coffee house going on. The first one was up there in Danielson.
Danielson, okay, the quiet corner of the state.
They were the first ones. It was Tom Pandolfi was the organizer of that, and then it just branched out. And you have more veterans that, they keep coming and coming. A lot of them say, well, why don't we have a coffee house on a weekend? Because the guys and gals that are working at EB that might have veterans-related questions, they're working at 9 o'clock, in the morning and stuff like that. But Colchester used to have a Saturday coffee house. I don't know if they do anymore. But.
Great. Well, again, Paul, we really appreciate you taking time out of your busy day. I know you're busy helping with veterans all throughout the day and going above and beyond for our community. So really grateful for that, for your service. And hopefully we can continue to highlight great people doing work for our veterans in the community like yourself, Commissioner Welch, and others throughout the state and country. So thank you again.
Thank you for having me, Irving. Appreciate it.